It's a very nice presentation led by Dr. Peter Voorhees, which is the Alliance randomized phase 2 trial, which is 80 patients strong, again with just as in determination, where we had almost 20% African American representation in our randomized phase 2 study from the Alliance. Our African American representation was close to 15%. And in that study, which is a very real-world study, it was designed to look at the key question of oral therapies in the era of COVID, really. And whilst that wasn't the original intent, obviously, the study enrolled and accrued and was carried out intercedent with the pandemic. And what we had was basically a design where we looked at the role of pomalidomide and dexamethasone compared to pomalidomide, ixazomib and dexamethasone, i.e. both all oral regimens, used after first relapse in lenalidomide refractory patients. And we're very pleasantly surprised to see that the POM-DEX arm performed well, around 7.5 months progression-free survival, perhaps had hoped for better. But what was remarkable was the performance of the triplet regimen of ixazomib, pomalidomide and dexamethasone, where the actual progression-free survival median was over 20 months. It was 20.35 months. That was highly statistically significantly different in favor of the 3 drugs over the 2. But this was an all-oral regimen. And what was important is in the study, we were enriched for high risk. Almost 40% of the patients had high-risk cytogenetics. So the fact that we were able to demonstrate that kind of clinical benefit from a 3-drug all-oral regimen in lenalidomide refractory patients in the era of the pandemic was, I think, an important real-world study to share. And certainly in the Alliance, we were very pleased because it represented a community-focused study that was really trying to provide patients and, of course, providers with guidance to relatively simple regimens that could be used for frailer patients, arguably, because it was very well tolerated, but also, for that matter, for patients who wanted to minimize clinic visits and take advantage of an active regimen, perhaps before embarking on more intensive therapy, such as an antibody.